Hi guys, good afternoon. Welcome back to my YouTube channel. This is Miss Henderson. It has been a while, so I am back with another video. So today I have a few questions on the TV. We are going to be going through these questions. I hope you like these questions. So I created them using my computer and PowerPoints to do them. So let's look at these questions. So the first question we have here states, guys, again, if you like these videos, please consider subscribing to my YouTube channel. Please like and share, and please subscribe to the YouTube channel if you enjoy content like these. Okay? So we are going to go over these questions. The first question has, which anatomic term means towards the midline? So look at the question carefully. Which one? Is it lateral? Is it proximal? Is it medial? Or is it posterior? Which one you think is the correct answer? Take a moment and think about it. Which anatomic term means towards the midline? So the only answer that make any sense there will be medial. Let's look at another question. A resident with AIDS has nausea and vomiting. Should eat A, small frequent meals quickly, high fat small frequent meals quickly, high fat dairy products, or spicy food. So what do you think might be the correct answer for this question? So take a moment and think about it. Should they eat quickly? Should they eat small frequent meal? The correct answer is A. That's the correct answer for that question. Question number 3. Which of the following is true of skin integrity? It feels heat, cold, pain, touch, and pressure. It becomes more elastic as a person ages. It is a chemical substance that controls the body. It becomes thicker as a person ages. So the correct answer for this question here, as we get older, our skin becomes thicker. Our elasticity also decreases. So the only answer for this question, it feels heat, cold, pain, touch, and pressure. That's the correct answer for this question. Guys, again, if you like these content, I create these content for the CNAs so they can pass their Prometric exam. So please consider liking these videos. Please continue to share these videos if it's providing values for you, so I can continue to do the videos for you guys. So the next question, what should an NA do when providing oral care for a patient with cancer? The NA should use commercial mouthwash for rinsing. The NA should use hard bristled toothbrush. The NA should assist the resident with brushing and flossing regularly. The NA should avoid giving oral care or give limited oral care. So what do you think is the correct answer for this question? The NA is the nurse's assistant. So the nurse's assistant should assist the residents with brushing and flossing on a regular basis. That's the only answer that makes any sense. So we have another question here. When atrophy occurs, does the muscle slowly become stronger? The muscle increase in size the muscle remains the same size and or the muscle decrease in size? What do you think is the correct answer for this question? So the only one again that makes sense will be that the muscle decreases in size. And that's why we have to do range of motion exercises, because as the muscle decreases in size, they're at higher risk for muscle contractures. Which of the following statement is true of how a nursing assistant should assist a resident with one-sided weakness after a stroke? The nursing assistant should lead with the weaker side. The nursing assistant should stand on the weaker side. The nursing assistant should use the term bad or messed up. The nursing assistant should not use gait belt during transfer. So you know when a patient has a stroke, they might have paralysis or weaknesses to one side of the body. So where would the nurse stand? You can't lead with the weaker side, so you're gonna have to stand on the weaker side to support the patient. So that's the only one that makes sense. Which of the following is a function of the nervous system? It pumps blood through the body. We know that's not true. That's the cardiovascular system. It helps the body take in oxygen and removes carbon dioxide. That's the respiratory system. It senses and interprets information from outside the body. That's the only one that makes sense. Number C. It helps the body digest food. No. That's the GI system. So the only answer is C. It senses and interprets information from the outside world. Respiration consists of intake and output, inspiration and expiration. So we all know the normal respiratory rate is 12 to 20 breaths per minute. Some books says 16 to 20, some books say 12 to 20. So one inhalation and one inspiration and one expiration is equal one respiratory rate. So the only answer that makes any sense, it will be B. The respiratory system is made up of the kidney, ureter, brain, spinal cord, trachea, bronchi, lung, atria, ventricles, and aorta. So think about this. The kidney and the ureter is which system? Urinary system. The brain, spinal cord is the nervous. Atria, ventricles is the heart. So the only one for the respiratory system is the trachea, bronchi, and lungs. Guys, this is the end of the video. Please consider subscribing to my YouTube channel. Please like and share the video, and please give a drop a comments, and please subscribe to my channel. And you can contact me if you have additional questions for CNA exams. I am creating an ebook. It will be available for sale soon, so you can contact me. The book is for sale, and it will be in a PDF ebook version, so you can contact me. It will have like a lot of Prometric CNA test questions. Thank you for tuning in, and you have a great evening. I'll catch you in the other video. Bye for now.